The practice of competency-based learning, as well as the articulation of entry to practice competencies, has been an area of focus in counseling and psychology for quite a long time. One of the distinct advantages of online learning is that we have an opportunity in GCAP to create a program rather than a set of courses. What this means is that our courses are all interconnected and build on each other in a way that is systematic, planful, and purposeful, so that they lead you towards the outcomes that we want you to attain when you have completed the program. Our purpose in doing this is to ensure that you have the competencies that you need to engage in professional practice, and that you have the option to meet the entry to practice competencies of various regulatory bodies in counseling and counseling psychology. We've spent a lot of time in this program looking at what it means to embrace a competency-based learning model, and then to clearly articulate the competencies that we all agree need to be reflected in our courses. You'll notice on this page that there are two different types of learning outcomes for the program. There are the transdisciplinary program outcomes. These are the same outcomes that you would expect to attain if you took any graduate program at Athabasca University, any graduate program at another university across the country. The purpose of these transdisciplinary program outcomes is to ensure that you have the foundational competencies as someone who comes to the workplace with a set of skills that employers would expect from those who have completed a master's degree. The second group of competencies are the disciplinary competencies. These are the competencies that have been articulated within counseling and counseling psychology. In order to create our list of disciplinary competencies, we did a careful analysis of regulatory bodies across the country, of accreditation standards, of other written documentation, and emergent principles within codes of ethics, the professional literature, etc., in order to come up with a consensus as a program as to what we felt were the disciplinary competencies that were most important for you to attain. If we scroll down, we can take a look at the overall transdisciplinary program outcomes. You'll see that there are 7 program-level transdisciplinary competencies. Scrolling down in this table, each of these program-level transdisciplinary outcomes has been broken down into course-level competencies. The reason we've done this is to make it easy to operationalize these within your courses and to be sure that we are actually teaching to these competencies as you move through your program. So for example, if you look at knowledge acquisition, you can see that there are a number of other course level competencies that feed into our understanding of the overall program outcome of knowledge acquisition. So in order to be able to evaluate critically and integrate knowledge from a range of scholarly sources and disciplines, you need to value interdisciplinary knowledge and promote interprofessional collaboration. You also need to be able to select appropriate information sources, including being able to discern the credibility of sources that are found on the internet and to evaluate critically the quality of research and scholarship. The disciplinary competencies are outlined in a similar way. In this case, we have 16 disciplinary competencies for the Master of Counselling program. We've organized these in what we think is a logical flow for incremental learning of these competencies as you move through the program. If you pay careful attention, you'll notice that they also reflect the counseling process. So in many cases, in terms of understanding the process of counseling, you would start with coming up with a foundational understanding of existing counseling models. You would look at how you then are going to implement those models in a purposeful and systematic way with your clients. You'll have to attend to culture and social justice, which is a really strong focus within our program, to ensure that everything you do with clients is responsive to their particular lived experiences and sociocultural contexts. All of this occurs within an understanding of the ethics and standards of the profession and the ability to make ethical decisions as you encounter challenges moving through the counseling process. Each of these feeds into the way that you position yourself as a practitioner and the professional identity that you assume. Once you have a sense of who you are as a practitioner and have the foundational understanding of counseling theories, can apply ethical and responsive and culturally just practices, then we move you into the how-to of counseling by looking at responsive relationships. How to establish an understanding of the problems and the preferences that clients bring to counseling so that you can clearly articulate preferred outcomes. We look at assessment and how various assessment tools can feed into your understanding of the problems and also the ways in which counseling might be designed through case conceptualization to provide a multicultural, contextualized, and strength-based lens on how to collaboratively implement change with clients. We then introduce the concept of responsive change processes, which essentially means designing goals and interventions which are responsive to the needs of the particular client. It's also then important to be able to track your progress within the counseling process and to articulate outcomes. More and more counseling organizations and funding bodies are looking for evidence that what we actually do is effective for clients. All of this is informed by the body of literature within counseling and counseling psychology. So we spend time in the program introducing you to the role of research and evaluation in counseling, and then giving you insight into how you actually engage in research and evaluation. Some of you will use this learning to be strong consumers of the body of literature in counseling and counseling psychology so that you can engage in evidence-based and supported practices with your clients. Others of you will take this a step farther and actively contribute to that body of literature by engaging in your own research, potentially through a thesis process. Once again, each of these program level competencies is broken down into a number of course level competencies. So if we looked first at the counseling models, in order to analyze critically existing models of counseling and client change, you have to be able to reflect critically on the socio-historical contextual foundations of prevailing counseling models. You also need to be able to analyze critically the evidence-based practice movement in counseling. I now want to give you a bit of a sense of how this competency framework that we've developed for the Master of Counselling program actually plays out in practice as we develop courses and as you move through courses as part of your graduate program. I'm going to use GCAP 633 here as an example. In the introduction to every course, there is a link to program and course outcomes. If you scroll down here, you'll see again in disciplinary competencies and transdisciplinary program outcomes. If you open this link to disciplinary competencies, you'll find a table that lists all of the assignments in the course and matches them to the program level and course level disciplinary competencies that are targeted in this particular course. In this case, you can see that one of the assignments that you do in this course is a cultural profile. The advantage of this layout is that you can immediately see that there are two core competencies that you are expected to demonstrate through this particular assignment. Let's scroll down a little bit further. You can see that there's a risk-taking journal that you will be completing as a part of this course. You can quickly also see that there are 4 disciplinary competencies that feed into that risk-taking journal. This gives you a sense of what it is that we're expecting you to accomplish through this particular task. Now let's look at the program transdisciplinary outcomes. You'll see the same table, and if we look at the risk-taking journal in this case, you can see that one of the transdisciplinary program outcomes that you're expected to accomplish through that assignment is the demonstration of cognitive complexity. Scrolling down further, you can see that there are also a number of transdisciplinary program outcomes related to leadership and interpersonal relationships that are included in the risk-taking journal. You are also expected to demonstrate professional capacity and autonomy as part of this assignment. And so you can see here the course level outcomes that are assessed through the risk-taking journal related to professional capacity and autonomy. Sticking with the risk-taking journal, I've now moved to the assignment page for GCAP 633. If I scroll down here, we can find the risk-taking journal. Opening that link, you'll see a link that provides the assignment description. I'm not going to look at that right now, but you also see the assessment criteria. This is where you will see all of the disciplinary competencies and the transdisciplinary program outcomes appear again as you look at what is expected of you in this assignment. So in this assignment, you are graded on a rubric, and your grade on the rubric will depend on how well you do on each of these program and course level disciplinary competencies. So for values-based practice, we've specified what would fall into each category of grade, and you're graded out of 10 for that particular competency. I'm going to keep scrolling down, and you'll see here the transdisciplinary program outcomes that are assessed through this assignment. In this case, as we saw in the introduction, cognitive complexity is assessed on the rubric. We also looked at professional capacity and autonomy, and you'll see again the same items that were highlighted in the introduction to the course have been translated into the assignment rubric grading scale. What this also means is that we have incrementally designed the learning within this course so that you're able to meet each of these competencies and outcomes. And then we assess them at the end in a way that is transparent so that you can see how you are developing these competencies as you move through your program. We have also mapped these competencies across courses. So let's take cognitive complexity, for example. There's quite a bit of emphasis in GCAP 633 on developing the skill of cognitive complexity. We hope that by the end of that particular course, you have a fairly strong tolerance for ambiguity, and you're able to see beyond your own values, worldview, and sociocultural contexts. However, that's not the end of your learning around cognitive complexity. The same skill will be picked up and developed further in other courses as you move through the program, so that as you move through the program, you are incrementally enhancing your competency with this particular program outcome. The same will be true of all of the program outcomes and disciplinary competencies. I hope this video has given you a bit of a flavor of how we have designed the Master of Counselling program and the ways in which this benefits you as a student. When you get to the place of applying for licensure as a professional counselor, a counseling therapist, a counseling psychologist, you'll be able to look back on your program and identify specifically where you attain the various competencies that may be asked for in the assessment of entry to practice competencies for that discipline. This will also give you a really strong foundation as you move out into professional practice to know really clearly where your strengths are, where your areas of continued competency may be, and to be able to build on this solid foundation of both transdisciplinary program outcomes and disciplinary competencies.